I'm Dr. Karima. I was asked to talk about um, functional medicine and supplements 101. So I decided to discuss this functional medicine through the angle of leaky gut and supplements to support the leaky gut. Every day our body is constantly exposed to a potentially harmful substance, might it be from food or bacteria, viruses, environmental exposure. And one part of being healthy is the ability of the body to filter these harmful substances. And the gut plays a huge role in this defensive system. The gut regulates water, electrolyte, and proteins transportation, and it's in his structure there is two sides, so the apical side that will be facing the lumen and the basolateral side that will be facing the bloodstream. So the gut barrier is a very smart system that can discriminate between harmful things and nutrients and good things for the body. And when it works properly, the gut can only allow the nutrients and good things to pass through the bloodstream. The problem is then when this barrier fails and this barrier loses its integrity, then things that were not allowed to pass this barrier suddenly can. And this is what we call the leaky gut. This is associated to a lot of disease, of course, digestive disease like IBS or liver-related disease, but a lot of studies shows that leaky gut is also related to cardiac disease, metabolic disease, hormonal imbalances. So it is very important to take care of your gut lining. We can see that the leaky gut is increasing in our modern societies. So of course there is some genetic susceptibility, but the most important triggers are environmental triggers and mostly diet. So if we look closer at the intestinal barrier is a multi-layer system. On the top of it, we will have the gut microbiota, that will be the good bacteria. And then we have a layer of mucus with chemicals inside that will be mainly antibacterial. Then we have a layer of cells, and underneath the layers of cells we have a immune layer. The layers of cells plays a central role in this protection. It's made of enterocytes, which are responsible for the absorption, goblet cells that produce the mucus, and the Paneth cells, they produce the antimicrobial substances. And these cells, they stick together thanks to the tight junctions. So between each cells you will find these tight junctions, and these tight junctions work like a smart gate. So they will open only to let the good things pass, and they will be closed when there is any harmful substance. Problem is that when you have leaky gut, we have dysfunction of this tight junction, and everything can pass through. Of course, all the layers of the gut lining are important, not only these tight junctions. So we have the role of the digestive secretion as well, the pH of the stomach, the digestive enzyme as well that can neutralize potential harmful agent. So of course, to protect your intestinal lining, you need to protect your digestive system from the beginning, and that comes from the stomach first. Role of microbiota as well. If the layer of microbiota if you have dysbiosis, then of course that will create inflammation and can affect the tight junction of the cells. The mucus layer as well plays a huge role in this defense mechanism. Mucus layers is not the same through the whole intestine. For the small intestine, it will be a very thin layer of mucus because we need the nutrients to be able to pass. And in the colon, the layer will be very, very more thicker to protect from harmful bacteria. Factors that increase intestinal permeability, of course, dysbiosis, infections, medication, alcohol, stress, diet. When the microbiota is imbalanced, So we lose the good bacteria, and the bad bacteria take the opportunity to overgrowth. Is why we call them opportunistic bacteria. They will create inflammation, and they will harm the intestinal barrier. Infection as well. The most common that we have is Helicobacter pylori, as well. Helicobacter pylori can affect the gut lining. Antibiotics, this everybody knows that they can ruin your microbiota, but not only antibiotics, paracetamol as well. We have studies that paracetamol, which we consider as a common medication, can affect the gut as well, and non-steroid anti-inflammatory drugs as well. Alcohol is a huge disruptor of the gut barrier, and even in small doses, you can affect your microbiota and gut lining with alcohol. And of course, stress. I know patients, they don't really like it when we say, oh, it's because of stress, because they don't get, like, everybody is stressed. We could talk about the stress like for more than a day, but when you're in a state of stress, you will affect your cortisol levels. Most of the time they will be too high. If you're burnout, then they will be too low, or you can be fluctuating in a bad manner. This will create inflammation. This cortisol dysregulation can affect a lot of things. Can create inflammation directly in the gut, so affect directly the gut lining. Can affect the hormones in the thyroids, so you will have kind of a state of hypothyroidism. Hypothyroidism will lead to slow digestion. Slow digestion will lead to, again, disturbance in the microbiota. So this is why we say stress, but if we want to dissect it and explain all the physiopathology of stress, there's a lot of things that are disturbed when we are in a state of stress. Diet, of course, as you know, high sugar, high refined carbs, low fibers, processed food will affect definitely the gut lining. So how to take care of your gut, and what are the key ingredients to take care of your gut? Certain food can help you, and certain supplements. So the probiotics, of course, they will help you take care of your gut. The most studied one are Lactobacillus rhamnosus, Plantarum, Acidophilus, and Bifido infantis and animalis. They are the most studied. If someone is suffering from leaky gut, of course, we will not directly go with the blend of supplements as we can find mostly in the market. It's the blend of different strain of probiotics. We will start very, very slowly with one of these strains, for example, Lactobacillus plantarum, because it's the most tolerated one, let's say. For a strain to colonize your gut, it takes at the very least 8 weeks. So at the very least, you need to take 8 weeks of probiotics. In a case of leaky gut, it's mainly 3 months to up to 6 months, depending on how the patient is dealing with his diet as well. We need the diet, of course, because the diet will bring us the prebiotics. Prebiotics, some patients, they buy it as a supplement, but prebiotics you can find in food. Vegetables and fruit are the very best prebiotics that we can find. So this fruit and vegetables, they have fibers. These fibers will be fermented by the good bacteria, and this will produce short-chain fatty acid like butyrate, and this butyrate will nourish the cells of the gut lining. Amino acids and vitamins that are good for the gut. We have the glutamine that most of people usually know, but arginine as well is a good thing to take care of your gut lining. Glutamine and arginine, even taken IVs, will have a huge impact on your gut, and you can have higher doses. And you can take orally as well. Vitamin A and vitamin D as well are much needed to support quality of microbiome and the gut permeability. The FODMAP management is always a huge conversation. So there is a lot of studies that shows that when we manage the diet with FODMAP and when we remove the FODMAP, we have an improvement of the gut, but this is usually something that is difficult to implement in the day-to-day. So this is not something that is mandatory. This is something that will help us. But if a patient is not willing to go for it, we can find other ways to heal the gut. But trying to, at least for a few weeks, separate from the FODMAP is a good idea. The polyphenols, berries, green tea, curcumin, they help as well reducing the inflammation and improving the quality of the microbiome. There is herbs as well that we can help to support the gut lining. Turmeric, berberine, ginger, and licorice, they are great anti-inflammatories, and they are great to reduce inflammation. We have other herbs that we can use for the gut lining support, but they will be more antimicrobial because leaky gut always comes with a dysbiosis and with bad bacteria overgrowth. In this case, that will be more oregano oil, olive leaf extract, grape seed extract, garlic extract, for example. And to finish, mushrooms, shiitake, reishi shaga, they act like prebiotics, but not only. They are anti-inflammatory. In fact, mushrooms, they have many properties. And I believe maybe properties that we don't even know about, but they have great properties. So yes, they act as prebiotics, but not only, anti-inflammatory, antioxidant as well, and they promote overall microbiome health. And thank you for your attention. If anyone has any question, I'm happy to answer. Yes. 100% yes. What will help you with Helicobacter pylori will be the mastic gum and the licorice root. But you need to be like 3 months of it. And then, of course, you need to watch out everything that is acid. So no juices, no gassy, no acids, yes. No acids.